For the past month, South Korea has been experiencing a full-blown medical crisis. What started as a simple walkout by the medical students and doctors have turned into a full-scale protest and resignation. Now, last week, the South Korea government has started to suspend up to 5,000 licenses of junior doctors. I want to talk about this crisis this week because I believe what Korea is going through right now is a foreshadow of what is about to happen in Canada's medical system if we don't change as well, and how that might affect our financial planning in the long run. And finally, what kind of solutions we can employ right now to help protect ourselves. Alright, without further ado, let's dive into this week's video. Alright, so first we have to understand what kind of issue Korea's medical system is undergoing right now and what kind of huge problem they're about to face. And it's largely coming down to three factors. First is a very serious aging problem. South Korea has 18% of its population that is 65 plus in 2023, but it is estimating that it will balloon to 39% by 2050, surpassing Japan, ranking number 1 for the most aged population in the world. The second issue they're facing is very low fertility rate. South Korea actually has the second lowest fertility rate in the world at 0.81, just slightly above Hong Kong at the second last. This is mainly due to high cost of living, high stress environment at work, especially city center, that lead to couples deciding not to have kids. And the third issue is very low doctor to patient ratio. According to 2021 stats, South Korea has one of the lowest doctor to patient ratio among developed countries. They are 2.51 doctors per 1,000 patients, ranking bottom 4, just ahead Mexico, China, and Brazil. So with these three elements combined, it is not difficult to see where this is going to head towards unless something drastically changes. Now, there are a few points that they want to address going forward, but the main thing they really want to do here is simply to introduce more doctors. So on February 1st, 2024, they have announced that they have decided to increase the doctor intake per year, going from the usual 3,000 to 5,000. And with this plan, they aim to add 10,000 more doctors to the system by 2035. Alright, so if you were to look at this, likely you would say we need more doctors in the future. That is clear. So let's add more doctors today. And also, more doctors means less patient workload for the rest of the existing doctors. This should be a no-brainer and a popular decision supported by everyone, right? Well, except it is not. Actually, the doctors were pissed upon hearing this. The medical association that represents doctors in South Korea came out with a very stern statement saying basically the government solution is not going to solve the deep-rooted problem that is in the medical system right now. And in fact, the government, by simply thinking adding more doctors will solve this problem, exactly show everyone that they have no idea why there are so little doctors in the system in the first place. Largely, it comes down to 5 major categories. The first one is simply the pay sucks in South Korea for being a doctor. Looking at online data, the median salary for doctors ranges from 86 million won to 164 million, with 124 million won being in the middle. Now in Canadian, that's 88,000 to 168k range, with the middle being 127,000. So looking at this from a Canadian perspective, even if South Korea has a much lower standard of living than Canada, we can still clearly see that this is not a good pay at all. I mean, a simple IT job or any managerial position is likely going to earn similar or a higher wage than what these doctors are earning for how much time and effort they have to put in to become a doctor and the amount of patient load they have to go through just to earn this income. But the problem doesn't stop here. They're also arguing that by adding more doctors, you actually are making the pay worse for everyone. Because in South Korea, medical is a heavily privatized sector, so most of doctors' income actually come from per surgery that they do. By introducing more doctors to the field, it is going to make it actually more competitive for the rest of the doctors, and it will likely lower profit for everyone. Second core issue they're stating is the patient load from the number of patients coming in and also amount of work they have to do per patient is getting more and more as time goes on. Basically, everyone is burnt out and work-life balance doesn't exist for being a doctor. Third point is the legal environment in South Korea does not favor doctors at all. Doctors in South Korea can easily get prosecuted and criminally penalized if they have any negligence that led to injury or death. Korea Medical Association released a study last November showing on average there are 750 doctors per year getting criminally charged with negligence resulting in death or injury of a patient. That is an insane amount of prosecution going on. That's on average more than 2 per day. Now, you may look at this and say, well, South Korea doctors clearly suck over there. That's why they're getting sued left and right. That may be true, but I actually think it's a little bit of both. They're definitely bad apples, but the stats clearly suggest that the legal system is probably very harsh and strict, or patients over there has a culture of easily making complaints or easily filing lawsuits. And if the laws and rules don't really protect doctors fairly, it makes it very pressuring to do their job on day-to-day basis if they think they will get sued any minute. Fourth core issue they're stating is that just by adding more doctors, it doesn't mean they are going to plug the holes that needs to be filled. In South Korea, there are fields among the medicals that are clearly more popular than the others. For example, cosmetic surgery. So if you just introduce more doctors, they may all just flood towards those fields and leaving the ones in dire needs not getting the extra doctors that was originally intended. And finally, they're arguing that by introducing simply 2,000 more jobs, the quality of medical services will drop significantly because originally those people weren't going to get accepted. So on February 20th, 12,000 junior doctors either walked off their job or submitted resignation. This is huge because they account for 30 to 40% of the workforce in major hospitals. And because of this walk-off, many surgeries had to be cancelled, patient service has to be reduced, and even ER had to be delayed because of lack of manpower. And shortly after, it was reported that an elderly man actually passed away due to delays in the ER. In response, the government hit back very heavily. They gave the doctors a deadline of February 29th to return to work or face possible suspension of the medical license. And of course, the doctors do not back down. So on March 11, the government have announced that since Monday, they have suspended 4,900 junior doctors' licenses. As of this moment, situation is still developing, so we'll see where we go from here. Now we have a better understanding of the core issue that Korea is faces. Let's look at the Canadian health system. Now, even though there are major differences in Korea and Canada's medical system, the main one being Korea is privatized heavily and the Canadian one is fully public, I still believe that there are enough resemblance for us to take a look and suggest that we may be facing a very similar issue. So first, let's look at aging. Even though we don't have as high of a percentage for people over 65 by the time we're 2050, we're still going up quite a bit. And also, one thing I'm wondering here, are they projecting this based on the amount of young immigrants that have been heavily coming into Canada over the last couple of years? If the immigration rules or the system changes and we have a lot less immigrants coming in, which are predominantly younger people, would our projection change and would we actually see a much higher percentage of 65 plus by the time we get to 2050? Now, second issue is fertility. Our fertility rate is not as bad as South Korea, but it is still pretty bad and it's dropping pretty rapidly. And for doctors and patient ratio, we're actually not much better than South Korea at all. Looking at the chart, we're 2.73 versus 2.51, ranking 22, only 2 spots above South Korea. Now, also according to a study by RBC, residency ratio has been lowering throughout the year, and I think one of the biggest reasons is pay. Even though our pay is twice as much as Korea's median wage for doctors, if we factor in the fact that cost of living is 50% higher in Canada in most cases, and also our highest tax bracket is 13 to 15% higher than Korea's highest tax bracket, plus the fact high student loan, high workload, and also the time it takes to become a doctor, is no doubt residency ratio is dropping over the year. And finally, I think everybody will agree that the infrastructure in Canada for medical system is very, very poor. There's already many articles or reports saying how long the ER wait, especially in Ontario.
20 hours, 30 hours, 50 hours. I've seen 100 hours, people waiting to get into hospital on stretchers in hallways.
So while I don't think our situation is as dire as South Korea, I think there are enough similarities here to give this a thought. Can we reasonably rely on our Canadian health system to take care of us in the long run, or rely on the government to somehow fix this impeding issue? Or maybe we have to budget and plan alternative solutions for ourselves. Now, don't get me wrong, I think the doctors are wonderful here. Like I've said before, we had emergency C-section when we were having our first kid, and throughout the whole procedure, every single medical professional was extremely professional, extremely good at what they do. We have full confidence in them. But the system of trying to get in and get their attention was extremely difficult, and we actually had to wait upwards to, I think, almost 35 hours before we could get into the surgery room. So this is why I want to make this video, because I think the infrastructure in the system in Canada is likely going to prevent us from getting adequate health care or the attention that we need, and we may actually have to spend a lot more money going to other countries or getting some sort of private health care. And the sudden healthcare costs can really impact our long-term retirement plan. So just for discussion's sake, let's look at a very typical Canadian couple. Both 35, have a 800k home, 20% down, earning 80k each. Each of them are saving $250 per month into their TFSA and $250 per month into their RSP each. Average CPP, maximum OAS, spending 75k per year on lifestyle. Someone like this, if nothing happens to them, they just keep going the way it is, they're growing at 6% per year, they will have about $3 million in their net worth total. Now, let's say one spouse here gets sick 10 years before retirement, so 55, and they get the big stuff, cancer, stroke, heart attack, and they spend 100k getting private healthcare elsewhere, plus they're off work for 5 years just to recover. This couple at 65 would now retire with just 2.2 million bucks. This illness that cost 100k in cost and 5 years off work just 10 years before retirement actually end up costing them about 800k in net worth. However, if this illness happens 20 years ahead of retirement at 45, their net worth at 65 would actually only be 1.87 million bucks. They would have their net worth almost cut in half. So it's not just 100k. That 100k, depending on when it happens and how many years you have to be off work, can have a massive ripple effect. It might actually make you going from comfortably retired at 65 to unable to retire and you have to keep working until you're 70, 75. And would you want that to happen to you if you just came back from a major illness and actually survived? So I think this is a good reminder that when it comes to financial planning, don't just plan in a straight line and assume we're all healthy and just retire on time. We also have to factor in potential healthcare issues and also consider implementing solutions that can help us mitigate this issue if it comes up. And here there are 4 potential solutions that I think everyone should give some thoughts to. They're all insurances, just to be upfront. Now, I'm not trying to sell you insurance and tell you that you must buy insurance. I just think that if healthcare costs or medical issue is a concern, is a valid concern that you have, they're worth considering and exploring. Now, the first one is critical illness. This is kind of like life insurance, but it's for your health. It usually covers around 28 different illnesses, and if you get hit with any one of them and you match the description, then whatever coverage you bought will be paid out lump sum tax-free to you. Usually the most common tactic is to buy a term insurance because they're a lot cheaper for a set duration, and you should be investing the difference to build a side pot. So the idea is that while you don't have that asset or lump sum to pay, that insurance can potentially cover you, and once you have built enough of a safety net, you can consider canceling the insurance. Now, this insurance is not going to cover every illness that you will ever come across, but I think it covers enough of the major stuff that it is worth taking a look at. Personally, I have it for myself. I have one for my wife. I even have one for the baby that we bought right away after she was born. And for her, it was a permanent one because it is a lot cheaper to get a permanent for a baby. So she doesn't have to worry about this when she grows up. Other than that, critical illness have different features in there that is often overlooked. The most useful one, I think, is Best Doctor, which is a hotline that you can call and get access to 50,000 medical professionals around the world for consultation if you believe you have one of those major illnesses. The second insurance that you should think about are disability insurance. So disability insurance pays you a benefit per month, usually tax-free, if you ever get injured or sick enough that you cannot work and you stay unable to work after a waiting period, usually around 90 days. On top of that, the insurance usually provide you a lot of assistance program or therapy program that really try to get you recover quicker so you can return back to work. Now, it is common for workplace to provide this insurance to you as a group benefit. However, I would recommend you taking a deep dive into what is actually covered by work and figure out how much coverage you're getting. Is it taxable? And also, when do they stop paying? Because usually after 2 years, the terms of the disability payout changes and it becomes a lot harder to continue to get paid. If you find yourself in a situation where you think the pay or the duration is not adequate enough, then you may want to supplement that with a private disability insurance. Now, I think this is one of the most important insurance because it also covers you in case of accidents like car crash, etc. If it hurts you enough, you cannot go back to work for a prolonged time. For me, I have it as well. I actually have this alongside with critical illness. So if I get those major illness, I'm out of work, I can't work at all, my disability will pay out and cover my day-to-day expense, while my critical illness will pay out a lump sum tax-free, so I can take that money and if I want to, go to somewhere like Hong Kong or US and get privatized healthcare. Now, the last one is more for the future, but it's the long-term care policy. Now, this used to be very, very common in Canada, not so much anymore, but basically they'll pay you a certain medical expense or cover the cost of hiring a nurse part-time or full-time to take care of you. Often, disability insurance gives you the option to convert that into a long-term care once you're past 65, so you might want to look at a disability ahead of long-term care. People often underestimate how expensive it is to hire someone to take care of you. On average, a 24/7 assistance in an institution costs about $60,000 per person per year. So if you have any parents or grandparents in elder home, I'm sure you know how quickly it erodes their saving. And if you don't want this to happen to you, then maybe a long-term care policy is something you need to consider. Now, the last solution is much more niche, and this is for you to consider a private healthcare or medical insurance in a country that provides private healthcare. We took a look at this when we were buying a private insurance for my mother-in-law. So if you have more faith in your home country's private healthcare, or you just want options, then maybe maintaining a medical policy over there can make a lot of sense. Now, usually when I work with clients, this is one of the components that I'll definitely have a chat over just to see if it's worth having something. It's not difficult to find an adequate plan according to someone's budget, so they can still save a decent chunk or the majority of their paychecks on the side to build that asset, build that net worth in the long run, while having these insurance provide a safety net for them. So that's basically it for this video. Now, I do want to hear from you. What do you think about our medical system currently in Canada? Are we heading towards the same path as South Korea, or we are much better than them? And also, are you doing anything about your healthcare costs potentially, or long-term care cost? Let me know in the comments down below. Now, if you like these kind of videos, I do upload them every 2 weeks, so make sure you subscribe to the channel, click the bell button to get all the notifications in the future. This is Jacky. I hope you found this interesting. I'll see you in 2 weeks. Bye!